Hello and welcome to Healthy India. I'm Lottie Yalurick. Well friends, this is a program which is meant for us as well as for you, because here we talk all about health issues. We pick up various health conditions, various health issues with a set of experts who tell you as to how to look after your health carefully. Well, today in our series, we will be talking about something rather important, something rather sensitive, and something which you and I really need to know about, as we will be talking about heart attacks. This is a term which is scary for many, and most of us are ignorant, but the fact is that if you make certain lifestyle changes and if you go for those routine checks, you can be sorted as far as heart attacks are concerned. So to talk about the same, I have in the studio an eminent panel of doctors. It is my privilege to welcome Dr. Sunil M. Raheja, who's from the Department of Medicine at the GB Pant Hospital. Sitting to his right is Dr. Rajat Mohan, who's a cardiologist at the Sir Gangaram Hospital. And to my left is Dr. D.K. Satsangi, who's also a cardiac surgeon at the Maulana Azad Medical College. So I take this opportunity of welcoming all of you on board. So well folks, before we start asking questions to our panelists, I'd like you as well as my panelists to take a look at this report.
In India, heart disease is the single largest cause of death, with heart attack being responsible for 1/3 of all deaths caused by heart diseases in the country. According to a projection by the World Health Organization and the Indian Council of Medical Research, India will not only be the heart attack capital, but also the capital of diabetes and hypertension by 2020. Epidemiologists in India and international agencies such as WHO have sounded an alarm on the rapidly rising burden of cardiovascular disease for the past 15 years. The reported prevalence of coronary heart disease in adult surveys has risen fourfold in 40 years, and even in rural areas, the prevalence has doubled over the past 30 years. In 2005, 53% of the deaths were on account of chronic diseases and 29% were due to cardiovascular diseases alone. It is estimated that by 2020, CVD will be the largest cause of disability and death in India. Heart attacks and strokes are major but preventable killers worldwide. A heart attack is the death of heart muscle from the sudden blockage of a coronary artery by a blood clot. Coronary arteries are blood vessels that supply the heart muscle with blood and oxygen. Blockage of a coronary artery deprives the heart muscle of blood and oxygen, causing injury to the heart muscle. Injury to the heart muscle causes chest pain and chest pressure sensation. If blood flow is not restored to the heart muscle within 20 to 40 minutes, irreversible death of the heart muscle will begin to occur. Muscle continues to die for 6 to 8 hours, at which time the heart attack usually is complete.
Well, folks, those are definitely alarming figures, and if we do not take control of the situation now, we would definitely be in a big trouble in the coming years, as we all have just heard that by 2020, CVD will probably be the largest killer. Well, now coming to you, Dr. Raheja, now we've just seen those figures, but I would like to ask you, if we talk about India, what is the prevalence of this disease, Asia and especially the Indians?
Yes, according to the estimates, cardiovascular diseases are the largest cause of death in the world. As per WHO standards, 17 million people, more than that, they die every year because of cardiovascular diseases, and more so in Indian. And Indian Asians are more prone to develop this disease, and it is the point of concern is, whereas the disease is on the decline in the developed countries,
right,
it is on a steady increase in the developing countries like India. And Indian Asians are the main population, almost 32% of the Asians which have cardiovascular diseases. The incidence of cardiovascular diseases in the Indian urban population, according to one survey, was 6.4%, and in the rural population it is 2.4%, and it is likely to be doubled in the next decades. And more so, the Indians tend to develop the heart attack or the myocardial infarction at a younger age. And the disease is multi-vessel disease, more serious, and that is the major cause of death, and it needs a urgent attention, because it is one of the disease which can be prevented if we take the right measures at the right time.
That's right. I think that's very well said, that if we take the right measures at the right time, this condition at least is far, far preventable. So my next question is to you, Dr. Rajat. Now, we have just heard those alarming figures, but what according to you is the most common cause, in spite of all of us knowing this? Is it lack of awareness when we talk the large part of the public, or is it our mindsets that we do not really pay attention to something which we feel will never happen to us?
Well, I think so. Basically, it is the lack of awareness also, and at the same time, there are certain reasons why we Indians in particular, or Southeast Asians, we are definitely more prone to all these problems. Now, awareness is definitely, as I've told you, but the things like that, we have got a very sedentary lifestyle. We really don't go around for all the healthy foods, and at the same time, the type of diets which are high in carbohydrates also. We are taking at times we are taking high fat diets also. Where a lot of saturated fats are there. Previously, we were consuming things like dalda, which had a lot of trans fatty acids, which was one of the major causes of dyslipidemia. Dyslipidemia mean to say that the cholesterol levels are high, the saturated fats are high, and all those things are there. At the same time, the number of Indians may be using tobacco products in the form of either BD smoking or tobacco chewing. And as Dr. Raheja told, that diabetes is also on the rise. So these are definitely the common causes which make us more prone to cardiovascular problems.
So, Dr. Satsangi, the awareness, of course, at one point it is not there. But even for the people who are aware, they think that, okay, right now I'm young, or right now I'm too young to get this disease, or maybe when I grow a little, and every time we feel that 10 years is, 10 years older is older, and we are okay, and nothing is going to happen to us. So, do you think that kind of mindset also has a lot to do with this?
That has a lot to do with that. And most of the time, the people are scared to go for checkup, thinking that if they are diagnosed as a case of heart disease, then they will get into the rigmarole of the stent and angioplasty and operations. So they just try to avoid it, which is not the right approach. Usually what they should do, that they should be in constant touch with their physician or cardiologist, and if necessary they should undergo time to time test, so that this disease can be diagnosed at an earlier stage before it strikes and does the damage which cannot be repaired.
I think that's something really very important what Dr. Satsangi just said. So, Dr. Raheja, what according to you as a doctor you think is the right age for a person to come for a routine check, especially the check of the heart?
Yeah, the right age should be, basically the thing is the right age to get checked is around 40 years. But whereas the process of atherosclerosis, it starts as early as the second decade of life. There are studies which show that the atherosclerosis or the deposition of plaque in the arteries, and we have a model here which shows that this is the photo of the heart. This is how the heart looks like. It has got, it's a pumping organ and it's a muscle. It needs oxygen and blood supply for functioning. It has got that blood supply through the three coronary arteries, right coronary artery, left descending coronary artery and left circumflex arteries. The process of atherosclerosis or the deposition of plaque, it starts as I've told in the second decade of life, as early as early. This is the normal lumen of the artery, normal artery, and as there is a deposition of cholesterol plaque or what we call a fatty substance, there is a narrowing of the lumen of the artery. Thereby the less blood supply is getting through it, passing through it to the the part it's supplying. Now, once it increases, there is further narrowing of the lumen, and we can see here that very little amount of blood can pass through it. And this is where the person can develop the symptoms of angina or chest pain even at sitting or on exertion with breathing difficulty. And when it ruptures, there is a thrombus formation, and which causes the complete occlusion or the complete blockage of blood supply to the part it is supplying. Thereby there is no blood going to the part of the heart which is being supplied by this artery, and this leads to the death of the myocardial cells, and it is also called the myocardial infarction. By that we means myo muscles, cardial means cardiac, infarction means death. So this will lead to the death of the muscles of the heart, what we call is heart attack.
Okay. Now, you have explained it to us in your technical terms, but I'd like to ask you here, Dr. Rajat, that he said that even in the second decade of our lives, you know, one could be at a risk. So, for people whose parents or grandparents have been patients of any kind of heart disease, do you think for them it is that age is all right for them to go for a routine checkup if it is hereditary?
See, normally one is that going for all the complete checkup, that doing all other non-invasive investigations.
Right, right.
One is that the other thing is for any person after the age of 20 particularly, he should at least get a lipid profile done to see what his lipids are like, and particularly so for patients or for individuals who have got a strong family history. Because as we have seen, out of all the risk factors, other risk factors also equally important like diabetes and cholesterol levels and all that. But family history is paramount, it's very important.
Right.
Because if a patient has a family history of cardiac problem, premature coronary artery disease, that is, his parents are having problems at the age of around 40, 45, 50 or so, the chances of the siblings having a problem at that particular age definitely increase a lot.
Okay.
And so after the age, around the age of 20 at least, you should tend to get a lipid profile done, see your fat levels, and if the fat levels are raised, then we should do active things like taking medications and lifestyle changes to bring them to normal levels.
All right. Now, Dr. Satsangi, in our country, we all know that diabetes is a huge, huge disease that we are all trying to grapple with. So, for the diabetics, you think that they must also come for a checkup of the heart? Are they at a higher risk than the people who are non-diabetic?
Diabetics are definitely at a very high risk, and they should be very careful about their heart. And apart from the diabetes, the hypertension, that is high blood pressure, and diabetes, they go together in most of the cases. And they are damaging the heart, and they can lead to the heart disease, coronary artery disease, whatever we call it. So, it's very important for the diabetics that they should be go to for the regular checkup, and apart from controlling their diabetes, it should be strictly controlled. They should be checked for hypertension, and time to time they should go for the heart checkup.
Right.
The common heart checkups are the ECG and echocardiography, and if necessary, even the angiography or CT angiography, because the diabetics may get heart attack without having pain.
Which is
painless heart
even more
attack.
risky.
The heart is damaged and they don't know about it, but only on investigation it is revealed that their heart is damaged badly, and then it's too late.
Yeah.
And therefore, for diabetics, a strict checkup, control of diabetes, blood pressure if it is there, and regular checkup of heart, and even the preventive medicines, like they should take Dispirin, they should have their lipid profile under control, they should take the medicines which control their blood cholesterol level, regular exercise, meditation, yoga, freedom from stress, all these things are important for diabetics.
Right. People, in a short while from now, we definitely will be telling you about all those tests in detail, what Dr. Satsangi has just listed. But before that, we'll have to slip into a very short break. But when you come back, it will be your turn to ask questions. So for that, the numbers are the same, which are 1800115314 and 23035420. So we'll be back in just a moment.
इलाज की गारंटी। उस्ताद जी, दमा, मिर्गी और शुगर का शर्तिया इलाज गारंटी के साथ, और पता भी लिखा है, आयुर्वेदिक दवा खाना, रामगढ़।
ओए खा गया ना कच्चा, ऐसे विज्ञापन ही तो हमें धोखा देते हैं।
बिल्कुल सही, शर्तिया इलाज और चमत्कारिक दवा ये सब झूठ है। ऐसे विज्ञापन कानूनन निषेध हैं। ऐसे विज्ञापनों की सूचना स्टेट ड्रग लाइसेंसिंग अथॉरिटी को देनी चाहिए।
ड्रग्स और मैजिक रेमेडीज ऑब्जेक्शनेबल एडवर्टाइजमेंट एक्ट 1954 का उल्लंघन करने पर जुर्माना, सजा या फिर दोनों भी हो सकते हैं।
मैं तो समझ गया, और आप?
Welcome back. This is Healthy India, and today we are giving you all the information that we can about heart attacks. There will be some myths that need to be broken, and people, all that you will find nowhere else but only on Healthy India. So this is your turn to ask your questions. The numbers are the same. I'll repeat them: 1800115314 and 23035420. My only request to you, as always, is to keep the volume of your TV sets to the bare minimum and listen to us only through your telephones. Well, now Dr. Sangi just listed a few tests. So, Dr. Raheja, I would like you to take this opportunity to go one by one, at least tell us what an ECG is for the comfort of my viewers.
Yes, the ECG is basically it reflects the electrical activity of the heart and the conductivity, the conduction system, and it's a very simple test which can be done in the OPD within few minutes by making the person to lie down comfortably, and the leads are applied, and there is a recording of the heart tracings on a graphic paper.
Right.
And it's a very simple, non-scary, few minutes test and very cheap test.
That's right, and no pain, no invasion.
And it can give us lot of information regarding the rhythm of the heart, rate of the heart, conductivity. If the person had any previous heart attack in the past for screening, because as Dr. Satangi has told, Indians are having 12% diabetics. That is 1 out of 8 Indian is a diabetic.
Right.
And in these patients, particularly elderly and in women, the symptoms of heart attack may be very less or may be masked. Even there may be no chest pain at all,
Right.
and person might have got the heart attack. And simple ECG can give us a baseline information what the condition of the heart is like.
All right. Well, at this point, we are joined by Mr. G.M. Rao from Maharashtra. So, Mr. Rao, if you're with me, what's your question?
Good evening, Healthy India. My
Yeah, very
question
good evening
is,
to you.
can a sensitive person suffer a heart attack on hearing an unexpected news or shock? And if so, what you should do in such a situation?
All
Thank
right.
you.
All right. It seems you've also been watching a lot of Bollywood cinema. Is that right? Okay. I think I'll direct the question to Dr. Rajat. So, an unexpected news, as he says, can that do
Oh,
some harm?
definitely. Any unexpected news per se, it jacks up your blood pressures, and also it increases all the basic metabolic rates in the body, and it can really cause a heart attack. So,
Okay, it can.
It can definitely do that. And the best thing to do is to maintain your calm in any way, whatever you can to do that, and that's it. And if at all you are having any problems, if you are having any pain chest or any discomfort, then the better thing is to visit your nearby doctor, and if required be, he can do an ECG on you, and he can advise you accordingly.
Right. So, what are the other tests that he just said, and if you can just explain them?
I think so. The most important out of all these things is that once a person comes to you, he is having chest discomfort, maybe that it looks like a muscular one or whatever, or it is not clear that what the type of test is. And if there are no particular reasons not to do a particular a treadmill should be the first thing what should be done in any patient who complains of chest discomfort. If the treadmill turns out to be positive, as treadmill is, what is treadmill? Treadmill is basically an ECG of a person when he is moving.
Right.
When he is walking, it is a similar ECG which is coming on a monitor. That is basically a treadmill. So treadmill is the simplest of the non-invasive investigations which should be done. And depending upon the results of the treadmill, we can decide upon that should we treat the person further for all the other investigations pertaining to a cardiac problem, or we can just stop at that and advise the person accordingly if he has diabetes or hypertension, just to control that and not worry about a cardiac problem.
Right.
So if the treadmill comes out to be positive, then definitely we should treat it further. We should manage it in a way that we go for an angiogram, do an angiography, see where exactly the blockages are.
All right.
And
So, we
then
will talk about angiography, but before that, we have with us Sunita from Panchkula. So, Sunita, if you're with me, welcome to the show.
Yes.
Yeah,
Good
please
evening,
go ahead.
doctors. Hello.
Yeah, please go ahead.
Good evening, doctors. ऐसा है, मेरे हस्बैंड का ना कोलेस्ट्रॉल लिपिड प्रोफाइल करवाया था
जी।
तो उनका ट्राइग्लिसराइड्स बढ़ा हुआ था, उसकी वजह से उनको एलडीएल जो अच्छे वाला कोलेस्ट्रॉल होता है उसका पता नहीं चला था। तो फिर किसी ने बोला कि एटोरलिप एफ लो, एटोरलिप एफ टैबलेट लो, उससे तुम्हारा कोलेस्ट्रॉल लेवल ठीक हो जाएगा। तो वो उन्होंने ली तो उनका काफी ठीक हो गया
जी।
तो नाउ टिल नाउ, मतलब नाउ आल्सो ही इज टेकिंग। तो इज इट ओके? और He smokes also. He says that I'm taking a lighter one.
All right. Well, I think I'll let the doctors take that question. So, Dr. Sangi, आप क्या बताना चाहेंगे?
I think Atorwas जो है वो help कर रही है उनको, there is no doubt about it. और जितना भी lipids को और triglycerides को under control रखा जाए वो ज़रूरी है. और उसके अलावा जो एक healthy lifestyle, that is very important. And he should take regular exercise. Smoking he should stop at any cost.
That's right. There's nothing like light smoke.
Smoking is a major risk factor.
Right.
So he can either have his cigarettes or he can have his heart. So he should stop smoking. He should have a regular exercises, healthy lifestyle, relaxation, and a diet which should be low in cholesterol and low in calories. And apart from there, he should also, if he has got other ailments like diabetes or hypertension, he should get it checked. If it is there, that should also be controlled.
That's right.
And he should be, consulting his doctor regularly.
Absolutely. So, please people, if you are watching today and if you think that there are some light cigarettes in the market, well, there is no such myth. So, please don't get carried away by any kind of advertisement. Smoking is bad, means it is bad. You have to remember that. Well, now we are joined by Sudhir Kumar Sharma from Jammu. So, Sudhir, are you with me?
Yeah.
Yeah, please go ahead.
Yeah, first of all, good evening to all of you.
A very good evening to you.
Yeah, Dr. Saab, मेरा question ये है कि I am 30 years of age and I was having intermittent blood pressure. Sometimes it goes up and sometimes it goes down. And doctor prescribed me a few tests. And I stood stood negative in all of those tests. But one test which was VMA test, vinyl Mendelic test, and the creatinine level was little bit higher side.
Okay.
So what would you suggest? How can I bring down that creatinine level? Because I don't want to go for medication, long time medication.
Okay, you've decided that already.
Yeah.
Well, let me see what Dr. Raheja will say to that.
Yes, as he is just 30 years, he is just 30 years of
30
age,
years of age.
and these creatinine levels are high. So serum creatinine levels are high normally in kidney diseases.
That's right.
And the blood pressure can be increased in kidney diseases. And the most important thing is he must keep his blood pressure under control by taking a regular medication.
Right.
It's not that he should take a medicine, it comes down, then it stops and it again goes up. So this zigzag pattern is more dangerous.
Right.
Because heart is getting more of stress with that. So the best thing to do is to keep your blood pressure within the normal range, and the recommended value of a normal healthy adult is 120/80. And anything more than 140 systolic and diastolic 90 is taken as grade 1 hypertension. Okay. And this he should do by decreasing the salt intake. The salt intake, a person in Indian diet takes around 15 grams a day. It can be reduced to 1/3.
Okay.
That is less than 5 grams.
5 grams, okay.
And at the same time, he must keep his cholesterol and lipid level under control, and the diet he should take. Normal Indians, they consume around 50 ml of fat in a day. And again, that should be cut down to 1/3, that is 15 grams. And that can be done by doing what? You should avoid puri, pakoda, samosa, achar, salty dishes, and cakes, pastries, which are rich in trans fats,
that Indians are very
and
fond of
namkeens.
having, yes.
They are very rich source of papad, and there should be no salt on your table and fat. You should avoid as much of trans fat, that is vanaspati, as we have already discussed.
Yes.
This is more atherogenic, and by that is being used in all the that biscuits, cakes, pastries, because the vanaspati is a hydrogenated refined oil which gets semi solid, and this increases the shelf life of the food.
That's right.
As well as it is a taste enhancer. This is what we get at dhabas and hotels food, curry we eat.
Right.
This is more dangerous. He should take all the precautions. Beside that, if he is smoking, he should stop smoking. Smoking increases the blood pressure, heart rate, it increases the cardiovascular, intimal layer injury increases, then increases the LDL levels, decreases the levels of HDL, that is a good cholesterol. And at the same time, it also increases the anxiety. sympathetic activity in the body.
So basically what you're trying to say here is that lifestyle changes are definitely a must, and if you don't make those changes, then all these things can happen, which today we are talking about. Well, now we are joined by Neena from Delhi. So Neena, if you're with me, welcome to Healthy India. Neena, are you there?
Yes, I am.
Yeah, please go ahead.
This is a question actually for Dr. Satsangi.
Okay.
Actually, my husband, General Vasudeva, he is suffering from, really high cholesterol. That is about 280 to 285.
Right.
Now, the thing is, they've been giving him some medication for lowering that, but it seems to be, carrying on. Now, he's about 62, 63 years old.
Right.
And I'd really like to know, is there anything else that he should do? So that it doesn't become worse, because his father died of, a heart attack.
Right. All right. Well, thank you so much for that. And I can definitely understand your concern out here. So I will ask Dr. Satsangi to take on.
I think the high cholesterol level anyway has to be controlled. And apart from medicines, the other methods which are quite effective is, number one is exercises. If he does regular exercises, and not necessarily very heavy exercises, even if he is doing long walk, and say about 4 to 5 kilometers every day, if he walks, this will also bring his cholesterol level down. And then the diet is another factor, particularly the bad cholesterol, which is low density cholesterol. So he should avoid particularly milk and milk products like curds, even cheese, and khoya, and all these mithai and all these things are very dangerous. And the high density level cholesterol, which is good for him, like safola is an example, which is good to bring down the cholesterol. And so exercise is one thing. Then high calories, his diet should be very much restricted. It should not be high calories diet. Drinks, not as such, but when person drinks, then he tries to overeat the things, and that leads to more calories and more cholesterol rise. So that he should always control. And even then, if cholesterol remains to be high, then he has to be under complete checkup. Maybe he may be developing coronary artery disease, but he is not to be scared of that. Today's time, even if there is advanced coronary artery disease, it can be very well taken care with coronary artery bypass surgery or by using the stents or angioplasties. And after surgery, after angioplasty, patients have long life. Absolutely. They can look forward to live for another 20 years, a trouble-free life, and can be reoperated or re-stented after that. So he need not be scared, but he has to be very careful, particularly his diet, exercise, stress, and medicines,
again, lifestyle
calories,
and intelligently, eating intelligently, basically. Well, people, it's time for us to slip into another break, but when you come back, I'll definitely take on the test that we were talking about, and we will tell you what angiography is all about and what is an angioplasty. So for that, you need to come back, but right after this moment.
संसद में आता है विधेयक, बनता है कानून, कानून होते हैं आपके लिए, दिखाते हैं आपको कैसे ये कानून आपसे सरोकार रखते हैं। देखिए मेरे साथ संसद से सड़क तक हर सोमवार रात 8 बजे।
Welcome back. This is Healthy India, and today we are telling you all about heart attacks. Well, people, it could be a scary term till now, but as my doctors are just telling you, you don't need to be scared. All you need to do is be careful. Well, as I promised, I'll tell you as to what an angiography is all about. So my question is directed at Dr. Rajat. So Dr. Rajat, in very simple terms, I would like you to explain to all of us as to what is an angiography.
Well, angiography is basically putting the dye inside the arteries of the heart and taking an X-ray of it, so that you know where exactly the blockages are in the arteries. Now, we can do the angiography either from the wrist or we can do it from the groin.
Right.
Either ways we can do it. If we do it from the groin, normally we tend to be in the hospital for around 6-7 hours. If we do it from the wrist, we can be discharged from the hospital in around 1 or 2 hours.
Right.
Now, the problem, what is important is that once you ask a patient that an angiography is to be done, then the first thing the patient says, when you do an angiography, you will say, okay, now you are in for a bypass surgery or you are in for an angioplasty. Now, this is a big problem, and all I want to say is that we should do an angiography. The angiography will not change the profile or the disease inside the arteries.
Right.
It will remain the same. Subsequently, to do a surgery or to do an angioplasty is totally your or your doctor's decision. So don't be afraid of getting an angiography done. We should do an angiography, and subsequently we can take a proper decision that if anything needs to be done or not. Nobody is going to force you, or nobody is going to tell you, okay, you have to go in for a surgery or an angioplasty.
And can that be done at the same time? Suppose in case if you do find that there is a blockage at the time that you are doing an angiography, or is it a different procedure altogether?
No, we are already half in. We are already, half of the procedure is already done. And if required be, an angioplasty can be done there and then. So it is, at times it is worthwhile to do the procedure simultaneously at that time, but it may not be a necessity all the time.
That's right, right. Well, this is what people you do need to remember, that angiography is an invasive procedure, but it is only discomforting. It may be totally painless because you will be under an anesthesia.
At the same time, I would also like to say, the risk in angiography is extremely low, and we should not be really scared that something will happen the time we do an angiography. And at times, number of our neighbors or people around tell ki it was very painful and there was a lot of problem. So, well, once in in one of the patients, you can have things like this, that the pain would be difficult. But it is very, very less. Normally, it's a very, very stable, safe, and it's a very quick procedure without much problems.
That's right. So people do keep that in mind. And now we are joined by Amitabh from Orissa. So Amitabh, sorry to keep you waiting. What's your question?
My age is 54. I had a heart attack in 1988, about 22 years back.
Okay.
Then this year, in 2010, I had a heart block and I have been put on pacemaker.
Okay.
My query is very specific, ma'am.
Yeah.
Whenever after after I have been put
with the pacemaker.
After the pacemaker has been installed in my heart, what is happening whenever my heart is running on pacemaker, they have set the heartbeat at 60, and then the blood pressure is also normal.
Right.
But whenever my own heart starts functioning, then the heartbeat is about 80 to 85. But the blood pressure shoots up to 110 to 190. 110 is the lower value, 190 is the higher value.
Okay.
This never used to happen earlier when, I used to have high blood pressure earlier also, but 110 by 190 was never the case.
All right. So
this
you want to know why?
Only after pacemaker has been installed.
Okay.
So I am at a loss what to do. My local doctor is not, is not able to help me much.
Right. So just remain online.
Increases whenever I go to him, he will increase one more medicine of blood pressure. That's all he's doing.
Oh, all right. Well, Dr. Rajas, would you like to take on that?
Well, I think so that it's important to find out that what kind of pacemaker also has been installed there.
Okay.
And subsequent, well, definitely that if the blood pressure goes high, your doctor will definitely put you on any antihypertensive medications. But I think so it would need more thorough investigations to see that why the blood pressure immediately shoots up. Definitely, as the heart rate goes up higher, there is a good chance that the blood pressure may go up higher also. But all those other things like which kind of pacemaker, is the pacemaker, some adjustments to be needed in the pacemaker, all those things have to be kept in mind. I think so it will need more thorough investigations that what exactly is happening there.
That's right. So what I can gather is probably he's looking for a second opinion, and maybe he actually, physically you need to go to another doctor and only the doctor will be able to advise you. But anyway, thanks for calling. Now, so we did talk about angiography and angioplasty. Now, once that has been done, what are the precautions that a person needs to take after that in terms of the diet or in terms of exercise? Maybe if he was into some kind of a heavy exercise earlier, can this person go for the same kind of exercises, or does the exercise need to be toned down?
Yes, basically, after the angiography, we will come to know the condition of the coronary arteries, how much blockage is there, or if the coronaries are normal. If the coronaries are normal, that person should be taken as a healthy male, healthy person. And the healthy person can undertake a normal exercise of 45 to 60 minutes of moderate exercise. That can be done in the home. It can be done as aerobics, sit-ups.
Okay.
Okay. And cycling you can do, walking, as we have already discussed. And in the walking, 45 minutes of walking, we have to make sure that we walk in a way that in the first few minutes you walk slowly and then you increase your pace.
Right.
You increase your pace so that your heart rate will also pick up, and that is where we call the conditioning of the cardiovascular system. And normally we take that peak heart rate should be 220 minus age, 85%. I mean, suppose if you are 50 years of age, you should be 220 minus 50, 170, 85% will be around 145.
Right.
If you achieve that rate of 144, 145, it's good enough. And that you can know yourself, or the moment you feel a bit, dyspneic, breathless,
uneasy,
that is the point where you should have achieved your heart rate. And then maintaining that pace for 20 minutes or so, you can slow down slowly.
Right.
So it is a slow process to pick up, plateau, maintain, then slow down.
Well, I'm so glad that you mentioned that, because people do walk, when you go early morning in a park and you see people on the phone or people just sitting, standing and chatting and walking. Well, guys, that is not the way you walk. Walking is what Dr. Raheja just explained. So do keep all that in mind. Well, now we have with us Mr. Mahendra Kapoor from Delhi. So, Mr. Kapoor, if you're with me, what's your question?
I want to know, there's a lot of talk about this cholesterol.
Yeah.
I am 69 and a half and I'm a diabetic. And I keep my sugar as well as other parameters under check also.
Right.
But I want to know what's the lowest limit which should be maintained for the cholesterol. When the minimum cholesterol level should be maintained.
All right. Well, thank you
because
so much.
Because cholesterol has so many functions, important functions too.
Okay, yes, thank you so much for that. So, Dr. Sassangi, would you like to answer
the normal cholesterol levels in cholesterol, we have the lipid profiles, triglyceride is one thing, and then we have the LDL cholesterol, and then we have the total lipids, and we have the HDL cholesterols. The normal values like total cholesterol should be less than 250, but ideally we keep it below 200. Similarly, triglyceride we can go up to 150 or so, lower level, and below that is acceptable. Okay. And the HDL, the high density level cholesterol, the normal value is about 40. So if it is little higher than 40 or in the range of 40, it is acceptable. That is how we go for that. Okay. But it's better, if we have the cholesterol at lower level, this is always good. And for that, as I said, regular exercises, and Dr. Raheja has said the diets, you should avoid milk products, you should avoid eggs are particularly very bad for cholesterol. Then meat, red meat is bad for the cholesterol. Some people say that white, that is the chicken, etc., doesn't do much harm. The fishes are even good. So cod liver oil and all that can help such
Well,
patients.
I think Dr. Raheja wants to add to that, so I'll give him that opportunity.
Fish, that is a rich source of omega-3 fatty acids, and they really stabilize your heart, and as well as it improves your it's a pleiotropic effect. And the omega-3 fatty acids are present in the fish. They are also present in the mustard oil, what the Indian cooking has, and also in this our olive oil is a good source of this, and even in that we should use more of MUFA or unsaturated fatty acids. All the oils like mustard oil, soybean oil, canola oil, olive oil, it's a bit expensive.
Right.
And all these oils should be used, and we should avoid using saturated fats, as we have discussed, milk products, dairy products, processed cheese, yellow part of the egg, that is again rich in cholesterol and fat. And even I must say here also, if we talk of lipid profile, LDL is one of the important component, and optimal levels of LDL should be less than 100.
Okay, right.
And anything up to 100 to 130 is taken as above optimal, and more than 130 is high. So if the studies have shown that Japanese have the least incidence of heart attack, because they consume lot of fish, which is and sea products, and they are rich in the omega-3 fatty acids.
Right. So, well, people, if you are fond of non-vegetarian food, you know what to eat. So, check out all those red meats, and even in white meats try having a lot of fish instead of the other things. Well, now we are joined by Asif Wasim. So Asif, if you can hear me, welcome to the show.
मैम मेरी एज 32 इयर्स है
जी,
और मुझे ब्लड प्रेशर का कुछ वो होता है, हाई ब्लड प्रेशर का उसमें, और मेरा वेट है 95 kg।
ओके।
हाँ, तो जिसकी वजह से कभी कभी बीट्स, हार्ट की बीट्स कभी एकदम से वो अचानक बहुत तेजी से बढ़ने लगती है।
आपकी हाइट क्या है आसिफ?
5'8".
5'8", ओके।
या तो थोड़ा सा ये जानना होता है कि मुझे क्या आगे प्रिकॉशंस वगैरह, और खाने पीने में भी बहुत ज्यादा मैं वो कर लेता हूँ इसमें, तो जिसकी वजह से मुझे कभी कभी प्रॉब्लम आ जाती है।
तो खाने पीने में आप क्या कर लेते हैं, गड़बड़ कर लेते हैं?
नहीं, नॉनवेज वगैरह कभी कभी ले लेता हूँ, जिसकी वजह से। जी,
राइट,
तो
ओके, ऑलराइट, थैंक यू फॉर दैट क्वेश्चन। और मेरे ख्याल से ये ऐसा सवाल बहुत सारे लोगों के मन में होगा, सो डॉक्टर रहेजा, वेरी क्विकली इफ यू कैन आंसर दैट।
The way he says the weight is 95 kg, that means he is obese.
Right.
And the ideal weight of a person, we can have a rough idea. Height into centimeter minus 100 should be the approximate of ideal weight of a person. Like he is 5 feet 8 inches. So his height is around 170 centimeters. So the weight for him should be around 70 plus minus 2, you can say.
So which means he is
so the first thing he has to do is to reduce the weight.
So Asif, I hope you are listening.
And because you know, to reduce the weight, the weight reduction is basically a simple formula. The amount of calories you are taking and the calories you are spending. So he has to take care that he takes the optimum amount of calories by reducing the intake, and in that he must reduce the intake of red meat.
Right.
Red meat contains around 46% of invisible fat, and normally people they eat in quantum.
That's right.
Without knowing what they are eating. So you can imagine, beside the curry it contains. So you can really believe how much of calories he is taking in one sitting.
That's right.
And he has to avoid all those fried items and puri, pakoda and
which
all
you
that.
Just mentioned.
And he must do regular exercise of more than 45 minutes, minimum 5 days in a week. And he must maintain that balance of calories intake and expenditure.
Right. So, well, all of you who are obese, do keep all these tips in mind, because they are not just meant for Asif, they are meant for all of you out there. So, at this point, we'll have to slip into another break, but people do come back quickly, as we still have a lot more to tell you about heart attacks.
बहन जी, रोशनी के माँ और पिता आए हैं।
बहन जी नमस्ते।
नमस्ते। रोशनी की पढ़ाई अच्छी चल रही है। आजकल मैं उसे गणित में जोड़ और घटाने के सवालों का खूब अभ्यास करा रही हूँ।
बहन जी, सवाल हो गए।
रोशनी की कॉपी तो देखिए, कल 10 में से 8 सवाल ठीक थे, आज सारे 10 के 10 ठीक हैं। शाबाश रोशनी।
शाबाश रोशनी। स्कूल चले हम।
Welcome back. This is Healthy India, and today we are telling you all about heart attacks. So people, if you still have a question on your minds, please be very quick. Call us right now, as our lines are still opened, and the numbers are 1800115314 and 23035420. Just remember, very quick questions so that I can take all of them. Well, coming back to you, Dr. Rajat, we were talking about, talked about angiography, but now a little bit about angioplasty. Very quickly, you can explain this to the viewers.
Angioplasty, again, the way we do an angiography, it is the same way we access inside, either through the groin or from the radial or from the wrist. After that, what we do is, first we take in a wire, we cross that particular area where exactly the blockage is, subsequently take in a balloon and we open that blockage. And the third is, and the last thing what we do is, we put in a stent. A stent is normally of, it's a metallic thing which when inflated remains there, and subsequently the balloon is taken out. Now what I want to tell the audience is that there are two types of stents. One is medicated stents, the other is non-medicated stents. The medicated stents are costlier stents, and the non-medicated stents are cheaper stents.
Right.
So
what is the difference really?
The difference between both the stents is, the non-medicated stents, they do not have a medicine inside which would stop the blockage in the subsequent months. Okay, and the medicated stents, they have got a medicine which helps to stop the blockage. Now, the chances of a reblockage in non-medicated stents are approximately in the range of around 20% in 6 months, while in medicated stents, they are around 7% in 6 months. It is always advisable that we should go for medicated stents than non-medicated stents. The only problem is medicated stents are slightly costlier. They are approximately around double the cost, or slightly more than that also, as compared to non-medicated stents. But if some individual is unable to bear the cost of a medicated stent, it doesn't mean that we should tell him that you cannot have an angioplasty done. We should put a non-medicated stent also in that particular individual, and at times that also gives a good release, and it is very helpful.
All right, right. Well, people, I hope you have understood the difference between medicated stents and non-medicated stents, and yes, you could go for any, whichever you can afford, and you will be fine after that. Well, now we have just time to take in Praveen Sharma's call from Ambala, Can. So, Praveen, if you are with me, welcome to the show.
Yes, madam, I want to ask question.
Yeah.
Some friends have retired from bank.
Yes.
Some friends have retired from bank, and they have got this heart problems. They have got treatment. They have got bypass surgery, and they have some got repaired valve also.
Okay.
So, for the purpose of this retirement benefits commutation, will they be treated fit after these problems?
Well,
when they have got these treatments, shall they be treated fit?
Will he be treated quickly? I don't know. I don't really understand the gist of what you're trying to say here, whether you're trying to ask me some policy questions here. Well, I'm afraid I can't direct those to my doctors today. Well, I'm sorry about that. But yes, he did mention about bypass surgery. So Dr. Sasangi, I'd like to ask you as to what is a bypass surgery and under what circumstances do doctors go in for that?
The bypass surgery, as the name suggests, is if there is a block in the normal artery which is supplying the heart, then we create a bypass.
Right.
Like we create a bypass in the road. See, if a road is very congested, we create a bypass and through which the traffic flows smoothly. Here also we create a bypass. And that is why we can use either veins from the leg, patient's own vein, or we can use arteries like internal memory arteries or right internal or left internal memory arteries to provide alternate blood supply to the heart. That is by joining it to the coronary artery distal to the obstruction.
Right.
And this is the alternative supply to the heart. And the first coronary bypass was done in the year 1963. And since then it is almost 47 years. Since then the people are doing bypass surgery, and it has stood the test of time, I would say, and still people, millions of people all over the world are undergoing bypass surgery.
So after a bypass, are these people at any risk after they have had a bypass surgery?
After bypass surgery, they tremendously improve. Their heart function improves. They can take heavy work, they can do exercises, they can play tennis, and they go on to live for almost 20 years after an arterial bypass, arterial graft. And it's not that after 20 years their life ends, rather they can be reoperated. If the grafts get blocked, they can have another surgery. People have undergone surgery even 4th time and 5th time. So just with the help of bypass surgery, they get a lease of say another 20 to 25 years or 30 years, and all the important works which they are supposed to do in their old age, like getting their daughters married, their son educated, settling in retired life. So it's a boon to the mankind, I would say. It's a great boon. And it is being done for last 50 years with very good results. And so people need not get scared. Yeah, I would like to add that don't think that surgery carries high risk. In good centers and in reasonably good cases, it can be done with a mortality rate of as low as 1% or maybe less than that. So it's very safe.
Okay. So Dr. Raheja, my next question is obviously connected. So if a person has had bypass surgery, what is the care that he or she must take after that in terms of, say, diet or the lifestyle? As he said, that they can live a normal lifestyle, but immediately after the surgery, are there any precautions that these people should exercise?
Yeah, the person must adopt the healthy lifestyle. They should not smoke, because smoking has multifactorial deleterious effect on the heart, increasing the heart rate, blood pressure, pulse rate. deranging the lipid profile of the person, increasing the bad cholesterol, decreasing the good cholesterol levels. They should adopt to a healthy life diet, which is rich in unsaturated fats. That is what we have talked about. Do a regular mild to moderate exercise, and in these patients, even if they walk for 20 to 40 minutes is good enough, and they need not to really do any moderate or vigorous, even mild to moderate is good enough for them.
Right.
And they must consult their physician before taking up the exercise, how much the heart can take, because going beyond that will be also deleterious. And they must eat well, sleep well, stay stress free, maintain a healthy lifestyle, and avoid hurry, curry and worry. And as we have discussed, they can live for decades.
That's right. So finally, some tips from you, Dr. Rajat.
Yeah, I think so that all individuals, particularly around the age of 40, and maybe with the increasing problems which are occurring in cardiovascular diseases, maybe 35 may be a better age to say today that they should start having a better lifestyle, and as hurry, worry and curry and all those things should be taken care of. At the same, it is very important that today, whenever we buy a packet of any namkeen or something, we should see that what exactly it contains. Because we just don't see it, we just rip it open and
just pop it in.
And just pop it in. We should see what exactly is there and how much of saturated fats are there, and then try. Eating a lot of sweets is not a good thing. We should maintain exercise program, and if prior to an exercise program, particularly if we are going in for vigorous exercise programs, it is better to do a treadmill if you are approximately around 35 years of age, and see that your cardiovascular profile is normal. And then you should go for a good exercise program. Exercise program is moderate intensity exercises for around 30 minutes every day, and maybe around 6 days a week.
That's right.
And some people tend to do that. I go up for a walk in the morning and also in the evening. That may not have any really more good effects than if you're doing it even once a day.
Just once a day. Well, finally, some take-home message from you, Dr. Satsangi, for my viewers today. Anything very quickly.
I think one should take care of the heart. The patient's whole life depends on the heart, and on him his whole family depends. And we should not forget that the human body, particularly heart, is designed to live for 100 years, and it's only by our wrongdoings that we shorten our lives. Therefore, we should be careful about exercises, a healthy lifestyle, about our diets. We should not be sedentary. There should not be lot of stress and strain. We should avoid smoking. That is very important. If we have diabetes, hypertension, we should not be careless about it. We should immediately control it, and we should remember that if we take all these precautions and medicine, and with the help of our cardiologist, we can again aspire to live for 100 years apart from the disease.
Right. Well, very nicely put, I think, by all the three doctors. But before we wind up, I'd like you all to take a look at these graphics through which we'll tell you exactly all those things in very quickly.
Symptom of heart attack: pain, fullness and or squeezing sensation of the chest, jaw pain, toothache, headache, shortness of breath, nausea, vomiting and or general discomfort, sweating, heartburn and or indigestion, arm pain, more commonly the left arm but maybe either arm, upper back pain, general feeling of illness, complications that can occur later, aneurysm, angina, congestive heart failure, edema, future heart attacks, loss of erectile function, loss of libido, pericarditis. Risk factors of heart attack: increased blood cholesterol, high blood pressure, use of tobacco, diabetes mellitus, obesity, family history of coronary heart disease, sedentary lifestyle.
Well, people, I do hope that today you have got all the information about heart attacks and especially as to how you can prevent them. As I think it's all very simple if you lead a proper lifestyle, and I don't think it's really very tough to do. As the doctors over here say that if you walk 5 days a week or maybe 6 days a week for 30 minutes to 45 minutes, and if you do not keep that salt on the table as one of the doctors said here, and if you do not really go and binge on the samosas and the namkeens, especially what we Indians are very fond of, and if you really put in a lot of fruits and vegetables in your diet and shun the red meat and go for the white meats and do all the things that all these three said, then I'm sure India definitely will be free of the heart attacks that we see today. And you definitely need to take a lot of care about yourselves. So on that note, I'd like to say thank you to all three of you for taking time out and for talking about this very important condition with me as well as with my viewers. So people, thank you so much for watching. Do catch me next week when we will be talking about some other health condition in detail. So till then, this is Lottie Alaric saying goodbye and take very good care of yourselves.